Good morning. Welcome to Breakfast with Louise Minchin and Dan Walker.
It is 6 o'clock exactly. Our headlines for you today. Testing times. Health leaders say NHS services could be at risk because staff can't access coronavirus screenings.
Those living in Birmingham, Solihull and Sandwell are banned from visiting other homes as new restrictions come into force.
Good morning. How many more people are out of work? How many more are claiming benefits? The latest employment figures are out in an hour. They'll tell us how things have changed for millions. But how much are government support schemes masking the true picture?
Never has so much been owed by so many to so few. The immortal words of Sir Winston Churchill about the men and women who fought and won the Battle of Britain 80 years ago. In 20 minutes' time, we'll take you on a flight in this magnificent machine.
And it was 31 Celsius yesterday in Jersey. Somewhere in eastern England could hit that today, but there's also a little bit of rain in the forecast. I'll have all the details here on Breakfast.
Morning to you. It's a Tuesday, the 15th of September. Our main story for you, a lack of coronavirus testing is leading to staff shortages across the NHS. That's according to a warning from hospital bosses.
They say the situation is putting services at risk and hampering efforts to prepare for winter. Here's Greg McKenzie.
Testing has come under intense scrutiny after people across the UK reported that they were unable to book tests or were being offered tests more than 100 miles away, like these people in Plymouth.
There is problems getting a test. I was told by the NHS there was none. There was none in the UK whatsoever.
We did it last week for my son and we were able just to come in.
Back in July, walk-in testing centres like this one in East London were being promoted. But now, walk-in slots are limited each day. And when they run out, people are simply turned away, including key workers.
I need to go back to work and I need to get tested. I've been trying since Friday evening.
Laboratories analysing swab tests in the UK are said to be overstretched, dealing with staff shortages and backlogs.
It's having a real impact on the NHS overall. So it means that trusts up and down the country are unable to start the restoration of services that we so desperately need to see after COVID.
The Department of Health has denied there were staffing problems and says labs are processing more than 1 million tests a week. Meanwhile, the rate of infection has more than doubled in Birmingham in a week to 88 cases per 100,000 people. From today, households across Birmingham, Solihull and Sandwell are banned from visiting other households or private gardens. The West Midlands Mayor Andy Street has said they may impose even stricter restrictions if the numbers of new infections don't improve. The restrictions will apply alongside England-wide rules that make it illegal to meet up in social groups larger than 6. Similar restrictions are in place in Wales and Scotland, but do not include children under 11 and 12 respectively. Greg McKenzie, BBC News.
Well, let's get a bit more detail on those extra restrictions which come into force in parts of the West Midlands from today. Guida Pense is in Solihull for us this morning. Morning to you. So give us an idea about how life is likely to change for some of the residents there.
Yes, good morning. As we heard, households here in Solihull, in Birmingham and also in Sandwell won't be allowed to mix, and that's because of the rise in coronavirus cases. In Birmingham, the rise in infection rate has more than doubled in a week to 88 cases per 100,000 people. So they're trying to take action, and what will happen today is essentially that if you live in these areas, you won't be allowed to have someone from outside your household or your social bubble into your home or into a private garden. And local officials say that when they've examined the data, that the rise in infection rate here is largely due to social interactions, in particular private household gatherings. Now, people here will still be able to go to school, will be able to go to their workplaces and also to venues like restaurants and pubs, as long as they adhere to the England-wide restrictions on the rule of 6 in those locations. But, you know, with a population of 1.6 million affected, it's going to be quite challenging for some people, particularly those who maybe rely on another household for things like childcare and other practical and emotional support. But local officials really do believe that by complying to these local restrictions, that they will be able to bring the infection rate down here.
Geeta, thank you for that. We'll speak to you throughout the morning.
A proposed law which would give the government the power to override parts of its Brexit agreement with the EU has passed its first test in the House of Commons.
Yeah, ministers say the Internal Markets Bill contains vital safeguards, despite fears that it could breach international law.
Our political correspondent Chris Mason joins us from Westminster. Chris, so what happens next with this bill?
Yeah, morning to you. Here we go again. Lots of Brexit noise, a late night vote in the Commons, a deadline imminent, and the UK and the EU can't agree. It's like 2019 all over again. What happened last night? Well, after all of the noise, the government won, and the government won easily. The government has a majority of 80. They won last night with a majority of 77. Just a couple of Tory MPs outright rejecting this idea that the government has put forward for a change in the law. 30 Conservatives, though, either abstained or didn't turn up. And so in terms of what happens next, keep a close eye on them, because there's been this huge amount of noise, hasn't there, in the last couple of days, real concern and a breadth of concern about the idea of the government choosing to break international law. Yeah, the opposition parties oppose it. You'd expect them to do that. But lots of senior Conservatives, former Prime Ministers, former Chancellors, former Attorneys General who manage the law or oversee the law on behalf of the government, not happy either. So when we get to the later stages of this planned new law, where MPs can tweak it, can amend it, that's where things could get very interesting, and the House of Lords to follow as well. We have not heard the last of this.
I thought we hadn't. Chris Mason, thank you very much.
President Trump is visiting California amid a deepening row over the unprecedented wildfires devastating huge parts of the west coast of the US. Mr. Trump said the fires were the result of poor forest management, not climate change. Earlier, his election opponent, Joe Biden, called the president a climate arsonist whose policies are contributing to natural disasters. Hello, good morning. Watching Breakfast with Louise and Dan this morning.
It is just after 7:30. Let's return to our main story. And the lack of coronavirus testing is leading to staff shortages across the NHS. This is according to a warning from hospital bosses.
They say the situation is putting services at risk and hampering efforts to prepare for winter. As promised, we're joined now live on BBC Breakfast by the Home Secretary, Priti Patel. Good morning to you. Thank you for being with us this morning. We will talk to you about police recruitment, which I know is what you're here to speak about this morning. But I wanted to start with an issue which is of real concern to many of our viewers this morning. The problem with getting testing in many parts of the United Kingdom. Can I ask you, first of all, Home Secretary, what, to your mind, is the problem? Are we looking at a shortage of actual tests? Is it a backlog in those tests being analysed, or is it a staffing issue? What is the problem?
No, well, what we are seeing increasingly more local lockdowns, and to be quite candid, we're obviously seeing rates of coronavirus go up. And we've been saying now every single day, we've been saying this for months, but we are restating this again, that if people are symptomatic, it's right that they get a test. And, you know, the fact that demand for tests is going up actually correlates with the fact that, you know, the numbers are going up of people with coronavirus too. We want to stop the spread of this disease. So right now, of course, the government has been consistently increasing testing capacity, but also laboratory capacity as well, to make sure that we can obviously get the results of those tests.
But there are
and alongside that, of course, there's a lot more mobile testing that's taking place, particularly in lockdown areas, but also home testing kits being sent to people, and clearly prioritising those tests for people that absolutely need them, people that are symptomatic, and also in the areas where we need to get people tested.
OK, you talk about those people being needs tests, particularly in those areas that require that. Let me give you an example of Bolton. Now, we looked at the figures in Bolton. Their rate at the moment is just under 200 cases per 100,000. Just to remind our viewers, currently, if you get to 20 cases per 100,000, that number would trigger the quarantine measures for countries that we have those air bridges with. That number is nearly 10 times that in Bolton, and yet people in Bolton can't get a test.
Well, look, I think the reality is, I can't speak specifically.
That is the reality. You can't get a test in Bolton at the moment. In fact, the top 10 worst coronavirus hotspots in England at the moment, there are no tests available.
Well, you've already heard me say that tests are available. You've heard me say as well, particularly in local lockdown areas, I've seen this myself. I've seen the teams that have been working on this. Mobile testing is going in, capacity is going into local areas where lockdowns have been undertaken and are taking place. So I think it is wrong to say that tests are not available. New booking slots are being made available every single day. Mobile testing units are being made available. And on top of that, home testing kits are being issued across the country, but specifically in local lockdown areas. That has been a consistent way of working and a consistent pattern since we've had the local lockdowns. And as we know, where there are spikes, where we've got local lockdowns, we also have more staff with Public Health England going into these local areas to make testing available and to ensure that the people that need testing, and let's not forget, through the local lockdowns, we have the Joint Biosecurity Centre that are able to evidence where the local hotspots are, right down to postcodes, to ensure that people in those areas, the actual localities, the hotspots, the actual zones, are getting access to testing.
OK, Home Secretary, you say you don't know of people not being able to get tests. We went filming in Oldham yesterday. Let me give you some examples. OK, we spoke to people. One woman who was told that she couldn't get a test in Oldham. She could travel to Doncaster, but that test would be available in mid-October. There was a carer who works in a home where there are children with learning disabilities. They have an outbreak. She was told, no tests today, keep trying. She has been there for a number of days. We spoke to somebody from Community Integrated Care. He said some of those tests are taking 10 days to come back. I've got an email here from a doctor who says that in their GP surgery, 6 of their staff can't get a test. Therefore, there are 6 surgeries that are being cancelled. They have a flu clinic on Saturday, which they're going to have to cancel as well. There are so many people contacting this programme who I would imagine cannot believe that you're sitting there this morning and saying there is not a shortage of tests.
Well, I haven't said there's not a shortage of tests. What I have said is that we are surging capacity in areas where we've had local lockdowns. And what I would say is clearly the examples you've given are unacceptable. And clearly there is much more work that needs to be undertaken with Public Health England and the actual public health bodies in those particular local areas. And, as a government, obviously, we work with Public Health England to surge where there is demand in local hotspot areas. And we continue to do that. And I have to say, if I can pick up those particular cases that you have mentioned, then clearly we will do that and work with Public Health England. There is a need, obviously, to grow capacity, increase capacity. That is something that is taking place every single day. You've also mentioned about people not getting access to appointments, booking slots. More and more booking slots are coming on stream every single day. More home testing kits are being issued every single day by Public Health England. And it's right that that happens at a local level. It has to happen within the community. And also in terms of getting access to testing, driving to locations, the majority of tests are available within a 10-mile radius. Now, it seems to me that there'll be extreme cases where people can't get to test locations within that radius. But that doesn't mean that, Public Health England are not working night and day to boost capacity and bolster capacity. They're absolutely doing that. And that is clearly, it's work that's ongoing. And as this, virus is spreading more and more, Public Health England are growing their capacity and ensuring that more testing capabilities are available on a daily basis.
And I'm sure you're aware, Home Secretary, that there's a big difference between capacity and the ability to process those tests, which I think is the frustration that many people are finding. Can I speak to you about NHS providers? Their CEO, Chris Hobson, this is what he's had to say about the inability of some NHS staff to get tests at the moment. The problem is that NHS trusts are working in the dark, he says. They don't know where these shortages are occurring, how long they're likely to last, how geographically widespread they are, and how likely and what priority will be given to healthcare workers and their families in accessing these scarce tests. They say that the government, to their mind, is more interested in managing political implications of operational problems rather than being open and honest with them about where tests are available, when they will be available, and making sure NHS staff can work with winter to come.
Well, I think, first of all NHS trusts, they work with Public Health England at a local level and at a national level. So, you know, in terms of transparency and ways of working, they are absolutely integrated. They really are. And that's the right approach. That is absolutely the right approach, because that means that NHS staff can have access to testing. That's absolutely right. They should be prioritised, and they are being prioritised. But, you know, the point about planning for winter is absolutely crucial. You know, we've started planning for winter as a government, working with Public Health England and the NHS, with Simon Stevens in the NHS over the summer months. So it's wrong to say that we're not building capacity. It's wrong to say that, you know, communications are not taking place. They are taking place. But obviously, where there are increases in demand, which we are seeing, coronavirus is on the rise. That is a terrible fact right now. Obviously, alongside that, we are increasing the number of tests that are available. And you've already mentioned about laboratories and the testing capacity. We are also doing much more in terms of investing and growing in that testing capacity too. The two go hand in hand. And of course, Public Health England continue to work with NHS trusts around the country.
There are other things I'd like to talk to you about this morning, but I do think that the way that you are portraying the testing environment in the UK at the moment seems very different to what many of our viewers are experiencing. Maybe we can come back to you on that on another occasion, because police recruitment is also an interesting area to talk to you about this morning. More than 100,000 people apparently have applied. How many of those 100,000 are suitable candidates to fill the 20,000 positions?
Well, so far in the last year, since we launched our campaign to recruit 20,000 more police officers, we have 4,336 new police officers already out on the beat, out on patrol across the United Kingdom, across the 43 territorial police forces. So demand is high. And of course, we made the announcement that we were going to recruit 20,000 more police officers with a target of recruiting 6,000 more police officers in the first year, which is up to March next year. And we've already recruited just over 4,000. So we're recruiting more and more on a daily basis. I give my thanks to the National College of Policing through their training centres, through the assessment centres, through the recruits that they're putting through right now. And I think it's really encouraging. You know, we've seen this throughout coronavirus. People want to serve in their community. We've seen more police officers out on the beat, engaging with the British public. And I think now we've seen more and more people want to join the front line. They want to be part of the frontline effort, join our emergency services, which is why I think it's very impressive, actually, that we've had 100,000 individuals apply to want to become police officers across the United Kingdom.
How many of those are suitable? That was my question.
Well, we've already had over 4,000 that have become police officers. So they've gone through the training programme already. The college themselves, they work with the territorial police forces where people are applying to assess and train the capability to assess the individuals that are applying.
Okay.
That's ongoing work, day in, day out.
Home Secretary, we're still, we're 21,000 officers down on where we were in 2010. So you're repairing the damage of the Conservative government, aren't you?
Well, actually, we're investing in policing in record numbers. And when you look at the funding that has gone into policing, it's the highest level of funding in over a decade. That is right and that is proper. We are committed to not just investing in police officers, but also when it comes to protecting our communities through many of the policies that we're bringing in, as outlined in our manifesto, in terms of reducing crime, tackling serious crime and violence. And if I may say so, let's not forget, policing has changed over recent years. Criminality is evolving constantly. So we are recruiting and training police officers to address the very crimes and the type of criminalities that we see on our streets right now, and obviously trying to protect and prevent future crimes. Crime is evolving, whether it's online, whether it's fraud, whether it's drugs. Crime has evolved over the last decade in quite an unprecedented way, so it's important that we recruit accordingly.
Can I ask you about some of those things the police might be asked to look at? This is the second day of the new Rule of Six law. The guidance, we understand, has been given to those officers this morning. Yesterday on this programme, Louise spoke to the Crime Minister, Kit Malthouse, who encouraged people to report their neighbours for suspected breaches of the new rules. Is that what you're asking the good people of the United Kingdom to do at the moment?
Well, I'm asking the British public to take personal responsibility for each and every one of us to, be conscious and not spread this awful, deadly disease. The fact of the matter is coronavirus is on the rise. We have seen, pockets of behaviour. We've seen illegal raves. We've seen mass gatherings. We've seen people actually not helping when it comes to preventing the spread of this disease. So we all have to take personal responsibility right now. We have this new Rule of Six. The police are very clear in their discussions with myself and the Prime Minister that they wanted a simple rule that they could enforce when it came to numbers, but also targeting non-compliance. And we have seen pockets of non-compliance over recent weeks and months. And it's right that actually when it comes to policing off this, deadly disease, that we all do the right thing, continue to wear face coverings, social distance, follow all the guidance that comes from Public Health England, but obviously that we, absolutely make sure that we're not gathering more than 6 people, and we're certainly not breaking the rules in terms of holding mass gatherings of 30 people or more.
You say do the right thing. Can I ask you then? I don't know what your neighbours are like, but if you saw 7 people in your neighbour's garden, would you call the police?
Well, I don't spend my time looking into people's gardens, but what I would say.
But let me ask you, because I think this is important for our viewers this morning, because they're asking for clarity, and you're the Home Secretary.
Well, the clarity is that people should not be meeting.
Okay, but I'm asking you, would you report those neighbours of yours to the police?
I think anybody, would want to take responsibility and ensure that we're not spreading this awful disease. And therefore, if I saw gatherings of more than 6 people, clearly I would report that, and it depends on the circumstances as well, where it be. But you've heard me say this already. I've been working with police officers over months now, several months now, to do our utmost to stop the spread of this deadly virus, which is why we have the process of fixed penalty notices, which is why the police have been enforcing against mass gatherings and putting in fines of over £10,000.
Okay.
I think it's right that we all take personal responsibility and we do our utmost now to stop the spread of this dreadful, deadly disease.
Home Secretary, briefly, I can't let you go without asking you about what happened in the Commons yesterday. 30 of your colleagues couldn't bring themselves to back the government over the Internal Markets Bill. There is opposition in the House of Lords. Are you willing to compromise on this issue?
Well, I think first of all there are important points to make actually about the UK Internal Market Bill, but also about the approach that we're taking as a government. Now, when it comes to preserving the integrity of the United Kingdom and clearly, delivering for the people of Northern Ireland when it comes to the Belfast Agreement, the Good Friday Agreement, we've said from day one. We've said this when the Withdrawal Agreement Act was, verified and went through the House of Commons and actually through the House of Lords, through Parliament, that we would always stand by our word and not compromise when it comes to unfettered access and goods and services, but also standing by the Good Friday Agreement. We are ensuring that the Internal Market Bill, the UK Internal Market Bill, stays true to that principle. And that is why we are bringing this bill forward, to absolutely make sure that we have the safety net and the right safeguards in place. That is also in line with our manifesto commitment. So there are no anomalies there whatsoever. We only had the second reading in Parliament yesterday.
Okay.
Obviously, this will go through committee stages, through the House of Commons, but Conservative MPs were elected on that manifesto to deliver for the people of Northern Ireland, to preserve the integrity of the United Kingdom, and also to fulfil that promise to get Brexit done. We're still in negotiations right now with the EU. Those negotiations are not completed yet, and obviously we want to hope to get the right outcome, but it's right that we have this safety net to preserve the integrity of the United Kingdom, but also to preserve the efficacy of the Good Friday Agreement.
Home Secretary, I'm not sure that answered my question about whether you're willing to compromise, but we are out of time, so thank you very much for being with us this morning.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.